Good afternoon, my name is Helene Budliger Artieda. I'm the Swiss ambassador to Thailand and I'm standing here in the crisis room of the Swiss embassy in Bangkok. We're doing today a video because we want to update you on the different options with regards to vaccines. And I must tell you, it's something that's fast moving. What I might have said in previous videos is no longer true, and that's why we felt it would be good to really update you. I also have to warn you, it's a lot of information because we will present to you 4 options. And that's why my wonderful team has decided to visualize some of these options, also maybe to help me so that I don't make any mistakes by introducing the options. Can I please ask Khun Dimple to join me with option 1? This is what we call internally the so-called embassy vaccination program. Because in June, remember, back in June, some of the registration apps weren't properly working, and at the embassy we got a lot of requests and complaints, and we felt that Swiss citizens, especially also those in vulnerable age groups, were having great difficulties to actually access vaccines. And this is why we started what we call the embassy vaccination opportunities. And I must stress, these are not vaccines coming from Switzerland. These are vaccines which are provided to us by the Thai government through their government vaccination program. But what we're doing is we're sort of a liaising agent. So particularly Khun Dimple actually is at the forefront of scouting opportunities. So she phones the Ministry of Public Health and she phones hospitals, and when we have secured a group opportunity, we advertise, we collect your interest, and we then register and design the groups and make it happen. And I think Khun Dimple was also maybe for some of you quite familiar because she was at the hospital. So far we have managed to secure 800 vaccine appointments. I think this is an ongoing process. Khun Dimple will continue phoning. And so far we have been able, through this embassy project, to vaccinate 600 people at a first dose of vaccine. Important to say, when you get the first dose, you immediately get your second dose appointment as well. So we're not going to leave you hanging for the second dose. Now you might say, well, the number is low, the number is high. I just have to tell you also, we get these group reservations in 20s. So every day we have slots for 20 people. And I must also report that every day we have a relatively high number of no-shows. So people that took a reservation with us and then for some reason decided differently. So we've, I think, had no day where we could really fully vaccinate 20 people, and that's why we're currently standing at 600. But we have decided to continue this program. So who should consider this option? It's people which are 50 years old or older, Swiss citizens. And if you have a medical underlying condition, one of these 7 designed by the Thai Public Health Ministry, of course you can also apply even if you're younger. And I think the good thing about the embassy program is that we first started in Bangkok, but by now we have also managed to secure 150 slots which have been vaccinated already in Chiang Mai, and we will continue our efforts to get a second slot of vaccines in Chiang Mai. Again, Khun Dimple will be at the forefront, and we're currently talking to public health officials about Udon Thani or potentially Khon Kaen. We don't know yet. That will be the 3rd region where we would like to go and offer these opportunities. So, as I said, these are vaccines coming out of the Thai public health system. So the vaccine, by definition, is going to be AstraZeneca. So you really have to think that if you register with us on this program, you will be 99.99% receive AstraZeneca. Maybe here and there somebody will get lucky and it will be Pfizer, but I really want to be upfront. It's really nearly 100% sure that it will be AstraZeneca. So thank you, Khun Dimple, that's option 1. Then option 2, Khun Khoi, please join me. You know, I've been part of a group of ambassadors who have actually regularly met with the Ministry of Public Health and also with Ministry of Foreign Affairs, and we have stressed the importance of equal access for foreigners to vaccines, and the government has responded to it, and the Ministry of Foreign Affairs was actually tasked to open up a government platform for expatriates, so for foreigners living in Thailand, legally residing in Thailand, and this registration platform has gone online as of 1st of August, and there was technical problems at the beginning, and there was also data protection issues because at one point you could see who had registered, but we're told by the Ministry of Foreign Affairs that these problems, technical problems, have been solved, and that the registration process is ongoing, and there've been over 30,000 foreigners that have registered with this system. Who can register? Currently, everybody can register, all ages. This is just the registration process is open, so that's a difference from Opportunity 1, where we have to call it 50 plus, but here everybody can register. I have to tell you though that the vaccination process, when it will start with 60 plus and underlying conditions, and then if you are younger, although you are registered and you gotten a confirmation that you're registered, you might have to wait until your age group opens up. The good thing also about this option 2, if you're not living in Bangkok or Chiang Mai or if we manage to do Udon, this is really a program that will be for the entire country. And the ministry has told us that they will start with Bangkok, because Bangkok is the province where you have most infections, so they want to make sure that in Bangkok we reach herd immunity as soon as possible. But then they will really look at needs. They will look at where people are registering, and they will spread out their efforts throughout the entire country. So I think this is an interesting option for people who are living maybe in more remote areas here in Thailand. What will be the vaccines? So these are also, since it's a government effort, this will be the vaccines that official Thailand has procured. It will be most likely AstraZeneca, but as you have read in the newspaper, Thailand has been given by the US government 1.5 million Pfizer shots, and might be more Pfizer coming in, and a percentage of these Pfizer shots, we have been told, are reserved for foreigners. So it can be that you will that you're among the lucky ones and you'll get Pfizer. But I have to stress, you cannot choose. So when you register, you cannot say, I only come if I get Pfizer. It'll be, I think chances are high that you'll be vaccinated with AstraZeneca. Now, you have several ways of getting into this expatvac program. One is to register on the platform, but then we know that private hospitals in Bangkok are also receiving direct registration from expatriates, from foreigners. MedPark has been in the news because it was also visited by a US official, Bumrungrad, so you can choose. Either you go through the central platform by Ministry of Foreign Affairs, or you approach a private hospital which is part of this program and you register with them directly. Option 2. Then, please, �𝐩𝐭𝐢𝐲, I will ask Sylvia to come and join me. If you're really only wanting to have either Moderna or Pfizer, I have to underline that probably your best bet currently is option 3. You would have to travel to Switzerland, but in Switzerland you have guaranteed either Moderna or Pfizer. You cannot choose, but it will be one of the two, because these are the only 2 vaccines which are used in Switzerland. So that's the big advantage. You will have that guarantee, but it's of course a very time-consuming and also costly affair, because you would have to stay in Switzerland up to 4 or 5 weeks, because that's how much time it needs between 2 shots. And then when you come back, it's also quite a hefty process. You will have to apply for your certificate of entry, and even though you're vaccinated, you will have to do a PCR test, And then, of course, you have to go to quarantine, and I'm not getting a sense that quarantine will be abandoned anytime soon, so this is most likely that you will have to go through this cumbersome process. But, of course, also very good, if you get vaccinated in Switzerland, you will have access to a Swiss COVID certificate, and if you have plans to maybe return to Switzerland or so, that's certainly a good thing. So that would be option 3. And then, if I may ask Phil to join me, option 4, if none of the before mentioned options are for you because you don't want to take AstraZeneca, or you for some reason cannot travel to Switzerland, then you have option 4. It's not an immediate option, but we're told that Moderna and Pfizer should reach Thailand at some time. And we would then recommend that if this is the only option you're going for, that you try to register with one of the private hospitals which will be distributing Moderna or Pfizer later this year. What to say about this option? There is still no confirmed date, although hospitals take in registration and you most likely will already have to pay for it. You will not have a guaranteed time when this will happen. I'm personally talking to the importer of Moderna, and I'm told that it will be the earliest last quarter of this year, but it could also be that you might have to wait beginning of 2020. And it's also the only option which the vaccine will cost you. So option 1 and option 2 are out of the government program, so no cost. In Switzerland, no cost for the vaccine, but of course traveling to Switzerland, staying there and so on will cost you. But this will be an option where for sure you will have to pay the private hospital, maybe both the vaccine and the service of the vaccination. So that's also something that you have to bear in mind. I know a lot of information, so I will ask again my colleagues to join me so that you have an overview once more, sort of a last shot. That you can have a look at these different options. Sorry, it's a lot of information. We will follow up with a circular note to all Swiss people registered with the embassy, so that you, in the comfort of your home, you can read quietly the different options, and if you're not vaccinated yet, make your decision which way you wish to go. Thank you very much for your attention.